My name is Johnny Dasono. I came from Indonesia. The reason I'm here, I'm bringing my father's. His name is Dasono, 73 years old. He suffered in valve problem and artery blockage. 2 to 3 months ago, I bring my father to Malaysia to medical checkup to heart doctor. They found out that my father has valve problem. That's why I'm keep looking which country do have my father have to do surgery. Then I get some information that going to India to do the surgery with Dr. Adil Sadiq. That's why we came here. I came to India on 6th January, and then I met Dr. Adil Sadiq. Then he told me how my father is going to take the surgery for a 5-inch on the chest and 1 inch on the leg. My father took surgery on 8th January and is done already. Until now, my father's feeling good, very good. No pain at all until now. So today we are going to discharge from hospital, and then all my father's diagnoses are good. The doctor says we have to wait until 7 days. Then we come back to hospital to do some diagnosis again, and then the doctor will give us the flight certificate. I think we are going back on 22nd of January. For my experience in Sakra World Hospital, the cleanliness is okay, pretty good. For the doctors, very good. For the nurse, also good. For the expert nurse, maybe few of them maybe getting some experience, maybe. For the international patient marketing, he's also good. His service is very good. Overall, is good.
Well, there are a lot of patients who require cardiac treatment outside of India. Some of the places that such patients live include developing countries like Indonesia, some parts of Malaysia, as well as people from Myanmar, Bhutan, Cambodia. The access to good facilities of healthcare is very limited. On top of that, there are some advanced countries, including Singapore, where the complexity of the surgery prevents many people from getting that kind of surgery there. India has emerged as a one-stop destination for medical tourism, and the most sought-after treatment in that medical tourism segment is cardiac surgery. Recently, we had a patient from overseas who had a complex condition. He had a severe valve leakage inside his heart. Out of all the 4 valves, 1 valve was not working well, and that valve needed to be repaired or replaced. In addition, he also had 4 to 5 blocks in the arteries of the heart. So, in fact, what he needed was a combination of a bypass surgery and a valve repair. Traditionally, most of these surgeries are done by a huge cut, around a 12-inch cut, but he came from overseas because he wanted to get the benefit of minimal access surgery. Using technology that's available today, we've been able to do the entire procedure through a 4.5-inch cut. We've been able to do both the bypass surgery as well as the valve replacement. So this particular patient required a combination of a bypass surgery as well as a valve replacement, and we were able to do it through a small incision, almost 1/3 the size of a regular incision. This is very important for patients because not only does it decrease the pain that a patient experiences, but also his recovery is much faster. There's less need for antibiotics, less need for a blood or a blood transfusion. Eventually, what we all want is a good result with a satisfied patient. There are multiple conditions that require treatment, especially for patients coming from overseas. Some of them come in specifically for minimal access multi-vessel bypass surgery. Some of them come for minimal access valve repairs or replacement. There's one unique procedure that we do out here. It's called the aortic valve reconstruction, also known as the Ozaki procedure. We're one of the few centers in the country to actually do that. So we attract a lot of patients from Southeast Asia for that particular procedure, apart from people from different parts of India itself.